Welcome to Advocate Today. I'm Aaron Dean. Abortion rights have become a big key issue for voters, and the GOP candidates for president don't all agree on what should be done on abortion. All candidates in the race support abortion bans at varying levels. Former Vice President Mike Pence is the only candidate who has said that he supports a federal ban on abortion at 6 weeks, which is before women know that they're pregnant. Pence is now accusing other candidates of being too soft on the issue.
Whether it be with Governor DeSantis or Nikki Haley or others on stage, frankly, most of the candidates running, including the one that didn't show up tonight, are all trying to relegate the question of abortion as a states-only issue. As I said, it's not a states-only issue. It's a moral issue. I'm also going to call for and lead for a minimum national standard of 15 weeks. I was glad to see at least one other candidate on the stage endorse that, but to see so many others, whether it be Vivek, whether it be Ron DeSantis, whether it be Nikki Haley, walking away from this principle, relegating it to the states, I think it was disappointing to me. It was probably disappointing to millions of Americans.
And South Carolina is reversing a ruling that backed a 6-week abortion ban. The Fetal Heartbeat and Protection from Abortion Act went into law back in May. It was immediately challenged in court. The law limits most abortions as early as 6 weeks into pregnancy. Planned Parenthood says that the court's decision will cause harm. Elon Musk's X is under fire for taking 2 days to remove the account for the gunman who killed a California woman over her pride flag. The account remained live 2 days after law enforcement publicly confirmed its existence. The gunman killed Lori Carlton at her shop in Cedar Glen on August 18th. A pinned message on the suspect's page was an image of a pride flag set on fire. The account also contained other anti-LGBTQ and anti-Semitic material. Musk took over Twitter last October and laid off 80% of its platform staff. UCLA's Williams Institute is researching the laws, policies, and judicial decisions that impact the LGBTQ plus community. Research director Kerith Conron is hopeful that the work being done there can lead to equality. So explain to us what you all do at the Williams Institute and why this work is so important to the queer community.
Well, the Williams Institute was founded by Chuck Williams over 23 years ago. We are at the UCLA School of Law, and we do research to inform law and public policy about a range of issues that impact LGBT people. And because LGBT people are such a diverse group of people, we end up working on issues like HIV decriminalization. We work on immigration issues. We do a lot of demography work. In fact, that's sort of one of our, I think, crown jewels at the Williams Institute is making sure that LGBT people are visible and counted, and that we understand their needs and issues and experiences. We have lots of work underway at the Williams Institute about the overrepresentation of LGBT people in state systems like child welfare, the carceral system. We are doing more work to try to understand the experiences of transgender people, in particular in incarceration. So we've been around a long time, and we are, I think, really adept at responding to emerging needs and opportunities to improve laws and policies that impact the lives of LGBT people.
Yeah. And, of course, like you said there, do a lot of research and work like that. So, when we talk about quantifying the number of LGBTQ plus and intersex individuals in the United States, tell our viewers why that is important.
Well, the old adage is if you're not counted, you don't count. And I think that's been particularly true for LGBT people. When I started out about 20 years ago talking to policymakers and even people in program settings about LGBT people, they would say, well, are there LGBT people in my state, in my district, in my program? I don't see anybody, therefore I don't think there are any people, and it's really hard to make an argument that we need to do something about LGBT people if they're invisible. And so a lot of our work has been around quantifying the population and describing and producing estimates of the number of LGBT people. Now, you raise the issue of intersex folks. Many people in the field, in the population, the Census Bureau, at the National Academy of Sciences, Engineering, and Medicine are all very interested and concerned about gathering data about intersex people. Because what we do know from some smaller convenient sample studies is that intersex people seem to look a lot like transgender people in terms of elevated risk of depression and suicidality, higher rates of disability. And we suspect that this is about some of the experiences they've had, particularly surgeries performed on minors without consent, that is trauma exposure. Of course, we need to gather more information, but we have at least enough evidence to say that intersex people seem to have a poorer health profile, and that there's a lot of need to understand and count this population. Right now, of course, research is underway to try to figure out some of the best ways to identify people who are intersex on surveys and then figure out sort of how to count them. But I will say it's definitely on the radar of many organizations, federal government, and work is underway to try to improve our measurement processes and data collection processes.
Anytime, you are surveying or doing research, there's always barriers that come up. When it comes to getting an accurate count of, on LGBTQ populations in the US, what are those barriers that you all have faced?
That's a great question. For a long time, we didn't have surveys that would identify transgender people on many surveys, and that's still an issue. There are only a handful of federal surveys that include questions that help us identify cis and trans people separately. So we've known more about sexual minorities for a while, and we can, because we've had more data from more data sets over time, we can look at trends over time and say, oh, the sexual minority population is growing over time. We can do that to some extent with transgender people, but not as well as we can for sexual minorities because we haven't had as much data for as long.
And over the years, has your research shown that more people are identifying as LGBTQ plus?
Definitely. We've been actually working on this at the Williams Institute, and we see an increase from like 2 to 4% of the population in 2013, 2014, identifying as LGB or LGBT. And now we're up to, close to 6% of the population. So that's a significant increase. And the places where we see most increase are among young people under the age of 35 and among women. And that's been really interesting, particularly because the growth is driven by bisexual identification among younger people, and again, particularly women. And so the growth isn't even, and it's going to be really interesting to try to figure out why that is.
With those numbers that you said are growing, is it because of any kind of sociological factors when it comes to acceptance? Is that why things are increasing?
That's definitely a chief hypothesis that people have, right? That we've seen on average greater social acceptance and public attitudes. Many forms of legislation that support and affirm LGBT identities over time. Of course, also many attacks too on transgender youth in particular and LGBTQ youth in the last couple of years in particular. But other theories people have about this increase. One is that we're seeing levels of identification, particularly among girls and women, and particularly among younger people, that map onto levels of sexual attraction to people of the same sex or same gender that we've seen in federal surveys now for quite some time. So that one theory is just that people are reporting identification in ways that better align with attraction now, perhaps because of greater social acceptance and greater visibility than we saw in the past. The Williams Institute has always been at the forefront of thinking not just about the LGBTQ or LGBTQIA population as a whole, but also thinking about the groups that are most marginalized. And so making sure that we're continuing to monitor the well-being of people who may be at the margins, people who are homeless, people who are incarcerated, people who are involved in other state systems, to make sure that their well-being is kept in the public radar.
Thanks so much for watching Advocate Today. Download the app in the Apple or Google Play Store to stream us live, and you can even subscribe on our YouTube channel. For the Advocate channel, I'm Aaron Dean, and this was Advocate Today.